We are now moving on to the most challenging part of OET listening. This is listening part C. Listening part C extracts are about 5 minutes long. The audio recordings in part C are based on topics of general interest related to healthcare. They include presentations related to the speaker's field of work or a professional's experience with caring for a patient, perhaps with a disease or a medical condition, or perhaps someone speaking about some action research. In listening part C, you need to listen to 2 recordings, which can either be a presentation or an interview involving a healthcare professional. For each recording, you will need to answer 6 multiple-choice questions. You should make sure that you are familiar with what you have to do before you take the tests. Remember that you will hear 2 extracts. In each extract, you will hear the instructions first. Listen carefully.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with a cardiologist called Dr. Jack Robson, who's an expert on Chagas disease. You now have 90 seconds to read questions 31 to 36.
As mentioned, you will hear the instructions first. This is the same for each Part C test. You hear a general introduction, then the context sentence, followed by specific instructions for each task. In the example above, you would expect to hear a workplace interview. An interview in Part C includes 2 speakers. One is a healthcare expert, and the other is the interviewer. The interviewer asks short questions, and the healthcare expert gives long answers to these questions. The interviewer's questions always relate to the questions you need to answer in your question paper. We are now going to look at the interview questions. Remember that before the recording begins, you have 90 seconds to read through the questions. In this interview, we will hear a cardiologist, Dr. Jack Robson, talking about Chagas disease. All the questions that you need to answer are all related to Chagas. Your job during the 90 seconds of preparation time is to understand what these questions are asking you to focus on during the recording. You can do that by remembering that in an interview, the interviewer will ask questions that are related to your question paper. In here, the interviewer is asking Dr. Robson about Chagas and why it is considered as a neglected disease. Question 31 is asking exactly the same thing. For question number 32, you will hear the interviewer is asking about concerns over Chagas in the USA. And in question number 33, your question is asking about a patient called Marisol. Your interviewer didn't mention Marisol, but instead he wants to know about an individual case that Dr. Robson has encountered. By the time you hear Dr. Robson reply, he mentioned a Bolivian woman called Marisol. We are now going to move on to the presentation questions. Although you will hear one speaker only on a presentation recording, the strategy on how to listen and answer is exactly the same. A presentation in Part C has only one speaker, who will talk about a number of different points. In the example above, expect to hear about the job of an occupational therapist from the point of view of Anna Matthews. The questions you need to answer in this section will be signposted first by Anna, the speaker, before they give you the answer to that specific question.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear an occupational therapist called Anna Matthews giving a presentation to a group of trainee doctors. You now have 90 seconds to read questions 37 to 42.
Similar to your interview questions, the 6 questions in a presentation should be the focus of your preparation within 90 seconds. The topic is occupational therapy. Hence, all 6 questions will relate to the job of Anna as an occupational therapist. Each question will be signposted by Anna first. Look at question number 37. In here, the question wants you to identify the main focus of Anna's work. Anna then introduced herself and mentioned that she will present a case about occupational therapy. This means that Anna will talk about her work, and your job is to identify the main focus or the most important aspect of her job as an occupational therapist. Next, question number 38 introduces a patient called Ted. This is an easy one because you will hear Anna also introduced a patient called Ted. You now know that Anna will soon be giving you the answers for question number 38. By the time Anna said Ted showed little interest in receiving treatment, you know that she has moved on to question number 39, which states that Ted seemed uninterested in treatment. Whether you are listening to an interview or a presentation, always identify these clues or hints, which we call signposting. In Part C of the listening test, you have to keep track of which questions the recording is referring to. The recording in the presentation includes cues that you can use to identify when to move on to the next question. The presenter will use a paraphrase form of your questions to signify that they are moving on to the next topic. The recording in the interview follows a similar structure. The interviewer's questions in the recording matches the questions in your task. Here are the final tips and strategies for listening Part C. The context prepares you for what you are going to hear. The word in the questions will help you identify the relevant part of the recording, and the answer can be heard in the recording shortly after this. The questions in Part C tend to ask for the general meaning or gist of the section of the speech. These questions also aim to test your understanding of the arguments the speaker talks about and the attitude or opinion of the speaker. The questions can be a direct question just like this one. It ends with a question mark, or the questions can be a complete sentence question. Your job in this part of the question type is to ensure that you can translate this into a direct question. So Anna says the main focus of her work as an occupational therapist, converted to a question, simply means what is the focus or the main focus of Anna's work.